This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take. Hello, everybody. Let's go ahead and open up that waiting room and let the people into our live Zoom. Yes, folks, we are live. Thank you so much for waiting and coming and being on here with us on Daily with Doc. It is exciting to have so many people in the waiting room. So as they're coming in, I just want to invite those that are watching the live stream. If you are watching us live or even a repeat of any of our programs and you'd like to join us, you may do so by going to dailywithdoczoom.com Monday through Friday from 12 to 1 p.m. Pacific time. So again, that's dailywithdoczoom.com. Now, we are a resource for an amazing community. And with this community, we have people that are health coaches, certified holistic health coaches, health advocates, practitioners, people who just love people and want to make sure that they have the information and opportunity to go from just barely surviving to thriving, or even those athletes that think they're on top of the world. We want to keep them on top. And in order to do that, it does require intentional supplementation, because that sweat is just not water that they're sweating out. It is a soup of minerals that the body really needs to hold on to. So if you're sweating them out, you got to be intentional about putting them back in. And that is part of the core of our foundation in what we recommend people do. Now, this program is being sponsored by dailywithdoczoom.com, where we have on our website past shows, articles, good foods, bad foods list. So people that are wanting to know, okay, what can I eat? What should I stay away from? You've got a simple list there that makes it easy to print out or save and be able to utilize each and every day, because folks, it even includes the reasons why you want to avoid or add them into your diet. All right. Now, all of our information is based on study and research, over 60 years that have been put into what we do on this show. Now, the research is firsthand from the man himself. It also includes that of other people, absolutely. But when it comes to the foundation of nutrition, I can't think of a better person to be able to lead this journey, this crusade to save humanity than the doctor that started this whole program with us. And today we have him. I know we had some technical difficulties yesterday, so we are able to watch an incredible part one of Somebody Needs to Go to Jail. So much information that was shared there. So I hope that you can really listen, not just hear, not just let it play in the background, but really pay attention to what is being said, because it could save your life or the life of others. Now, this program is not meant to take the place of your primary care physician, nor is it meant to treat, diagnose, or cure any disease. But folks, when you give the body what it is starving for, the body can do some amazing things. It is continually regenerating cells. So if it's getting the nutrition that it needs to create healthy cells, then the body has no other way to go than become healthier. But if you're not giving the body what it needs, and you're giving it all these processed foods that are empty of nutrition, or high sugar, high carbohydrate foods that affect the body in a negative way, including inflammation, and then fried foods. Oh my goodness, so many things that are fried that are causing damage within the body. Even if it's a good food and it's cooked the wrong way, it does damage within the body. So we want to make sure that people are aware and that there are no questions about what is causing their dis-ease within their body. Now, because we are a resource to an amazing community, if there was somebody that shared this program with you, make sure that you get back with them. If you have any questions at all about anything you hear on today's program, they are your point of contact. So get back with them. Now, if you have never spoken to anybody, or you have never tried any of the recommendations that are shared on this program, you are more than welcome to give us a call at 855-949-3377. I do have a team of certified holistic health coaches manning that phone line, or you can email us at questions@dailywithdoc.com. That's also the email if you have questions that you'd like to hear answers from Dr. Joel Wallach, or pharmacist Ben Fuchs, or Dr. Taylor Mitchell, or Dr. Laura Dennison, or Cara Ringland, naturopath, or myself, or any of our coaches. questions@dailywithdoc.com. Okay? So without further ado, we were talking about the foods that you should eat, even if they're good things that are cooked the wrong way. Well, we get the question a lot about kidney stones and gallstones. So that's what we're going to be talking about today. And to talk with that, just to communicate with us and share with us what those two different stones are, how they different, what causes them, what we can do to get rid of them, because they are very painful and cause a lot of discomfort and havoc within the body. We have the one and only, the doctor who has started this all, the doctor who worked his way through veterinary school, in a pathology lab, writing papers, doing the research, finding things that even toxins that were polluting an environment of a herd of sheep, a flock of sheep, rather, sorry, and 500 of them died overnight. He, at a young age, found the cause, found not just the cause of death, but the cause of death and the source of that cause. And that's what he has been doing on so many different levels, not just with animals. I mean, he's done autopsies on over 452 different species. Humans are one of those species with thousands of autopsies on humans as well. So help me welcome to the screen Dr. Joel Wallach, naturopath, doctor of naturopathic medicine, licensed in California and Oregon, California being one of the hardest ones to become licensed in. He also has 3 postdoctorates, and I'm kind of starting at the back going the wrong way. 3 postdoctorates in pathology, a doctor of veterinary medicine, a Bachelor of Science in Agriculture, studying plant and soil sciences. So Dr. Joel Wallach, welcome to Daily with Doc. Thank you so much for being here. I know Friday is not your normal day with us, but I appreciate that you are available to us to help us spread the message of what, when, why, and where when it comes to these stones that happen within the body. So welcome, Doc.
Well, thank you, and thank you, team, for everybody being here. It's a real pleasure to be with the team, which is our family, and can't thank everybody enough for all the good things you do to get the information out there. 2 things, as you pointed out, Rebecca, that gallstones, which are in the gallbladder, and then also kidney stones, which are in the kidney, are extremely common. And of course, doctors, they want to put you on dialysis and take your kidneys out and all that kind of stuff. And they want to take your gallbladder out and maybe even remove part of or all of your liver and so on. And this is all going the wrong direction. Okay. And so this is why we came up with so many books. In fact, 2 days ago, we sold 200 copies of the book, Dead Doctors Don't Lie. 200 copies in one day. Dead Doctors Don't Lie. It goes into
200 copies of this book?
Huh?
In which language?
I don't know. It's in 25 languages.
Well, I know the recording is in 12 different languages.
We sold 200 of a couple of days ago.
Was English?
English.
All right, fantastic. So this is available in English and Spanish, easily available. So make sure that you get your copy of Dead Doctors Don't Lie. You can find that at drjwallach.com. That is drjwallach.com.
Yeah, and of course, that's our biggest selling book. We've sold over, what, 300 million copies?
You're right up there. Yep, I know the lecture has over 400 million.
Yeah.
Of the same name.
And it's the most listened to nutrition lecture. Dead Doctors Don't Lie. Okay, so all this is related to many, many different health issues and diseases, and viruses, bacteria, fungus, and yeast. And so we have a lot of experience with this stuff. So here we go. First thing you have to do, if you have in your family kidney stones and let's see here, also gallbladder stones. Okay. And it's one of those things where these are not genetic. Well, a whole family has them. Okay, well, they're all eating the same recipe that grandma gave them. Okay, that's why they all have it. It's not a genetic thing, but they're all eating the same recipe, even though they're 50 miles apart or 200 miles apart. If they're eating the same recipe, they're in trouble. Okay, so none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no brown rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. Carbonation neutralizes stomach acids, so you cannot digest food or absorb minerals. Very, very important stuff. And like I say, we have 25 best-selling books. The newest one is The Metabolic Syndrome. Okay.
Found this on the web for 25 best-selling books. The newest one is Metabolic Syndrome. Check it out.
Turn this off.
Yeah, go ahead and just turn the volume down, Doc. So Dr. Wallach was mentioning the Metabolic Syndrome, which is one of the newest books that I was able to and honored to be able to help him put together, the Metabolic Syndrome. And it goes over the different diseases that are part of that cluster of diseases that they call the metabolic syndrome. And like he said, is not genetic, not genetic.
Yeah, well, the metabolic syndrome, okay, is featured by abdominal obesity, big fat belly, type 2 diabetes, and hypertension, high blood pressure. Those three things together are found in 30% of the American adults in America. 30%, 1/3 of American adults have the metabolic syndrome. And then there's 50 other diseases that won't kill you, like red itchy skin and hair falling out and that kind of stuff are also in this book. And it's 40 pages. It's 40 pages. It's one of our soft cover books. It's 40 pages. Okay. And so this can add many, many health years to your life. And, we deal with people who have, they're 100 pounds overweight, 200 pounds overweight, 300 pounds overweight, 400 pounds overweight, 500 pounds overweight. These are real people. Okay. And so we get them going on the right nutrition, right diet, supplement program. And usually within 90 days, they're a totally different normal person. So we have a lot of experience with this. And so getting these books is an easy way for the average person. If you can read the 5th grade reading level, you can do it, okay? And each of the cranial nerves, there's 12 pairs of cranial nerves in the spinal cord. In the book, It's All in Your Head, there's 30 pages in that book. Each chapter, okay, and there's 12 chapters, okay, and each chapter represents one of the cranial nerves, okay, and so when you have this is what doctors, they love people with osteoporosis of the skull, and osteoporosis of the skull affects the spinal cord. It affects the 12 pairs of cranial nerves, and in this book, my favorite book, It's All in Your Head. Top picture is that of a normal skull. They've taken the top part of the skull off and looking down on the brain. You see the skull, normal skull is a 1/4 inch thick. The bottom skull, they've taken the top of the skull off, looking down on the brain, and the skull is 1.5 inches to 2 inches thick. Well, the skull, okay, it's in.
Just down, Doc. I can hear you clearly.
Okay, thank you. The skull that's osteoporosis is squeezing those 12 pairs of cranial nerves. And, there's 12 different types of specialties, one of which goes with each of the pair of nerves. And each chapter in this book represents one of these cranial nerves. And the odds are you won't need to have your head amputated, and you won't need to have your nerves cut out and your hearing mechanism cut out and so forth. You'll be deaf and so forth. This is all reversible once you know what the truth is about osteoporosis of the skull. Okay. And then, of course, for the spinal cord, goes into a lot of things south of the neck. Okay. All of these nerves coming out of the brain. Okay. And of course, we have the CD that goes along with the book. Okay. Now,
well, Doc, before you go any farther, you were talking about the nerves. And I don't know how many people realize the vagus nerve is attached to their ears, their lungs, their heart, their intestines, their stomach,
their liver, their legs, their reproductive organs,
yeah, so if you've got something going on up here, squeezing and preventing those signals from going through or causing damage to any of the nerves, you're going to have some problems. And when I hear somebody saying, oh, I had my nerve endings burnt, and I'm like, oh my word.
Yeah, and of course, each chapter in here represents one cranial nerve. So there's 12 chapters, And then, of course,
Mhm.
the spinal cord. 12 pairs of cranial nerves in the spinal cord. When they get squeezed, you can have there's over 50 different diseases. Doctors love osteoporosis of the skull. They won't tell you have osteoporosis because they say, oh, your 10th cranial nerve, your vagus nerve is in trouble. So we have to remove several of the branches and blah, 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 blah for the pain to go
Well,
away.
they don't even tell, Doc, they don't even tell you about the vagus nerve. They work at where you feel the pain,
Mm-hmm.
not upstream and what's actually causing the pain. So again, folks, you can get Dr. Wallach's books at drjwallach.com, drjwallach.com, and Dr. Wallach, all of his publications are there. So Doc, let's go back to kidney stones and gallstones. Are they the same? It's just different in the different organ?
Well, the principle is the same. When you have, for instance, kidney stones, okay, this is calcium that's been removed from the bones of your legs and your pelvis and your ribs and your so forth, your skull, and the calcium is trying to be preserved. Your kidneys are trying to keep the calcium from going out of the body, and they collect in the urinary bladder. They collect in the kidneys, and they get bigger than a pea. They begin to cause pain and block blood flow, of urine. Then doctors want to remove your kidneys and put you on dialysis and all this kind of stuff. And so they're going the wrong direction. And of course,
So why, Doc, why would calcium being pulled out of the bones? Isn't that where we want the calcium to be?
yes, well, when you are not getting enough calcium coming in, you need calcium in your heart, you need calcium in your liver, you need calcium in your lungs, you need calcium in your muscles, you need calcium in your tendons and ligaments, you need calcium in your brain, you need calcium in your blood. And so if you're not taking in enough calcium in your diet through supplementation or eating properly or both, your body starts pulling calcium out of your bones to supply the calcium to all these other places. And so when you get kidney stones, this is telling you that you have terrible osteoporosis. You don't have too much calcium, you don't have enough calcium. And your body is robbing the calcium, what's left out of your bones, to try and support your need for calcium.
Okay. So that totally, I think, explains a lot for people, especially those that already have arthritis or osteoporosis or anything going on with their bones and kidney stones. Or they do blood work and the doctor says you have too much calcium in your blood. You got to stop eating milk or drinking milk, eating cheese, and taking calcium supplements. That's the opposite of what they should be doing. Isn't that?
That is correct. That is correct. Those instructions are the opposite of what should be done.
Okay, so let's move on to the gallbladder. What
Okay.
is the cause? What are gallstones made up of?
Well,
What causes
gallstones, gallstones are made up out of the essential fatty acids. Okay, we have the EFA pluses. Okay,
But
and
those are good.
Yeah, I take 3 of those 3 times a day. I take three times a day, the EFA pluses. And this provides the raw materials to make the covering of your nerves, okay, your brain, your myelin, and your brain and spinal cord.
So you're talking cholesterol,
okay,
which is
and
good.
also it helps you with sex hormones. Okay, you need the cholesterol to make sex hormones for both male and female. And so if they're putting you on a cholesterol reduced diet and putting you on medication to really knock down your cholesterol levels in your blood and your tissues, you're going to have 20 different doctors
You're gonna have problems.
sending their kids to college based on your insurance payments to them.
Right. So, okay, if we need EFAs, essential fatty acids,
Yes.
we need that good cholesterol. Why would cholesterol be building up as stones in the gallbladder?
Okay, well, when you circulate cholesterol, Okay, and you get to a certain level, it's pulled out of the circulation into the gallbladder, and which I say, it starts accumulating and it gets dehydrated, and so it forms these pea-like size stones in the gallbladder. And so for a long time, I don't know, over 100 years or more, doctors have been making a living just removing people's gallbladders because they had 2 or 3 gallstones in there, which are painful. And so they
Right.
would remove their gallbladder because they had gallstones. And really, they didn't have to remove their gallbladder. All they had to do was take all the 90 essential nutrients, including, want to take the EFAs, okay, essential fatty acids, and you want to take the
How about the ultimate enzymes?
ultimate enzymes, okay, EFA plus. You want the ultimate enzymes, of course, help digestion.
Mm-hmm. So, okay, there's good cholesterol, there's bad cholesterol. The bad cholesterol is, I mean, sugar converts to or contributes to bad cholesterol. Fried foods and those bottled oils contribute to the bad cholesterol.
That is correct.
Is that the cholesterol that's building up in the gallbladder that's causing issues?
That's correct.
And is it just a digestive issue as well?
Well, it's not just a digestive issue. It is a digestive issue, but it also impacts the brain and spinal cord, because 85% of your brain mass, your spinal cord mass, is cholesterol. It's called myelin. It's the white matter of the brain and the spinal cord. And so when you're not getting all the right foods and all the right cofactors, it shows up wherever you have large amounts of these things. Okay, the ovaries, the testicles, they all get hit with which they say improper usage of this. Okay, cholesterol is one of your best friends. Okay, makes sex hormones. Okay, and also is 85% of your brain and spinal cord. You don't want to be taking drugs to reduce your cholesterol. You want to be eating properly so you don't damage the cholesterol.
Right, right. All right. Thank you so much for that, Dr. Wallach. We get a lot of questions about kidney stones, a lot of questions about gallstones. And I've even heard of people that have had their gallbladder removed and they're still getting stones that are in that duct.
What will happen is when you remove the gallbladder, there's still the tubes in the liver, okay, moving bile around, okay, to get the bile out into the intestines and help you absorb essential fatty acids and fat soluble vitamins and so forth. And you can still get terrible pain. You can still get gallstones in your liver. They don't necessarily have to be in the gallbladder.
And a lot of people don't realize that. So it's not just a gallbladder thing, but those stones can be also in the liver. Well, Dr. Wallach, we have some hands up. Are you ready to take some questions?
Yes, ma'am.
All right. Just as a reminder, folks, if you are invited to this program by somebody specific, make sure that you get back with them. If you have a question for Dr. Wallach and get his advice on what you can do nutritionally to address some of the symptoms that you are experiencing, then raise your hand. If you're out on any of the different platforms and you have a way of commenting, you can absolutely comment and put those questions up, as we do have people on our team that are fielding those questions. And something that just came in, and I want to read this, Doc, off of Rumble. One of our amazing followers says, "Thanks, Becca, for sending me the reruns. Have been having computer issues and haven't been able to listen to them so much, but they are in my favorites. I thank you, Becca." Well, those reruns being sent, that's because of AJ. So I want to make sure credit is going where it needs to. He said that he had found a testimonial of an older lady about her arthritis being all gone, and says that these kind of videos make us avid listeners okay. Sometime I believe the food industry, along with a couple different entities, are making our foods not so healthy, and I'm going to say on purpose, And there sure is a lot of research showing that. So thank you, Dr. Wallach. He says Dr. W, but Dr. Wallach, Becca, all the coaches, etc. God bless. Keep teaching. Please, we are listening. So we just want to do a thank you, everybody, for listening, because we know that we are touching a lot of individuals and helping them to obtain a better health journey. So let's go to Marilyn. Marilyn, what question do you have for Dr. Wallach today? Go ahead and unmute yourself.
Yeah, I have two. The first one, plaque.
All right.
Some people say plaque can just be calcium only. Is that possible?
I'm sorry, say this again.
Can calcium buildup be just, can plaque be just calcium buildup, or is it always cholesterol, fatty substances, all of that?
Well, elevated calcium will cause other things to happen. And so you get this collection of a bad environment, the calcium begins to deposit in unusual places. Okay, it could be muscle, it could be brain, it could be arteries, walls of arteries and veins, and so, and it begins to fill up the diameter of those arteries and veins. Your blood pressure starts going up, and then you start getting abdominal obesity, and you get type 2 diabetes. You also have now what? Oh, you have the metabolic syndrome. And one third of Americans, adults, both male and female, have the metabolic syndrome. All these things are going wrong in them because they're not taking supplements. They're just eating what their family ate many years ago, but they may have been in a different place. They may have been 200 miles away. They may have been 1,000 miles away, and their parents may have been getting, let's say, they may have been getting 50, 60, 70 minerals in their food where they came from, the land flowing with milk and honey. And you're getting food from the local grocery stores. They get it from a garden that only has 3 minerals in it. Well, I'm eating the same exact recipe my mom and dad ate, and they didn't have these problems. Well, that's because they were getting 50 minerals and you're only getting 3.
So the calcium contributes to the gallstones and kidney stones?
Calcium deficiency contributes to a lot of things, because every organ in the body, every tissue in the body requires calcium. Whether it's your brain, your liver, your heart, your lungs, your intestines, your stomach, your muscles, your kidneys, okay, what should I say, your skin. And so these nutrients were put on us by the good Lord. And when you look at all mammals, whether they're whales or buffalo or antelope or deer or rats or rabbits or raccoons, cows, sheep, dogs, cats, they require all these nutrients too. Now, in animals, we don't have health insurance. You notice we don't have health insurance for animals like we do people. And so most people are not going to pay $100 a month for health insurance for their puppy dog. So that's why we came out with the Arthrodex supplement program for dogs and cats and rabbits and so forth, monkeys and so on. And it covers a lot of territory. Okay. You have to appreciate when a coyote kills a rabbit, they don't just eat the meat, they eat the liver, which rabbit has been accumulating minerals for some time in the liver. So they eat the liver, they eat the heart, they eat the muscles, they eat the tendons and ligaments in the skin. And so they're getting a lot of different tissues. They're not just getting a steak just made out of red meat.
Okay. One other question. I have a woman wrote into the show, so I don't have any measurements on her. She just says she has extreme itching. Her face, it's extreme psoriasis. It's like she has sheets of skin peeling off of her face. Is she lacking essential fatty acids? Kind of correlating with all of this that we're talking
Do we
about.
know how much she weighs?
I don't have any of the measurements. She just
Okay,
wrote.
well, let's go by 100 pounds. Okay, for every 100 pounds, she needs 1 healthy brain and heart pack, okay, per month. Okay. Take a half a dose twice a day if she weighs 100 pounds. If she weighs 140 pounds or more, get 2 healthy brain and heart packs. Take a full dose of breakfast, full dose of dinner time. Then she needs to get 2 or 3 bottles of the hair, skin, and nails. Take 3 of those at breakfast, lunch, and dinner. This could give her skin what it needs to be happy and healthy, but she also needs the EFA plus, which goes into the essential fatty acids that are necessary for good skin and muscle and tendon and ligament health and bone marrow health to make red blood cells and that kind of stuff. And so, you know, you go back several hundred years ago when people were transferring from people who just went on herbs from the local herbalists and so forth to going with medical doctors and so on. And this transition caused an enormous amount of new diseases nobody had ever seen before. Okay, because for 200,000, in some cases 300,000 years, okay, the Neanderthals, which were the cavemen, controlled the earth for over 200 to 300,000 years. The Neanderthals, the cavemen, controlled the earth. Now, the interesting thing about them, when they killed an animal, they ate everything. The heart, the liver, the brain, the skin, but also they put wood ashes from their heating fires, their cooking fires and so forth. They put the wood ashes into their gardens for fertilizer because they saw when they threw, just to get rid of them, they would throw the wood ashes into the gardens and the places where they threw the wood ashes in, the plants flourished and they got more yield and so forth. So everybody started putting wood ashes into their gardens, and wood ashes were their source of minerals. Okay. And then also coal ashes. September 4th, 1882, every big city in the world flipped a switch and went to electricity. Suddenly now there was no more wood ashes, no more coal ashes to supply our minerals. And suddenly now we're getting all these diseases that were due to mineral deficiencies that nobody had ever seen before. And doctors said, oh, it's a genetic thing. Genetics are whether you're a boy or a girl. Genetics are whether you have black skin or white skin, or you're Oriental. Genetics, what color hair you have, what color your eyes are. That's it. There are no diseases
So you're saying
caused by bad genes.
yeah, so you're saying there's genetic traits, but there are no genetic diseases. Two totally different things.
Well, there's genetic traits for eye color and skin color.
Right.
There's 3 or 4 things, just 3 or 4 things. That's it. But everything the doctors don't know, they say, oh, it's a genetic thing. Well, no. Whether you're a boy or girl is not a genetic thing. It's a nutritional thing. Okay. It's determined when you were an embryo in your mother's uterus, the early stages of pregnancy. And this is why they're having all this confusion with boys that think they're girls and girls that think they're boys and so forth, because they're getting confused in the early stages of pregnancy by not having the right nutrients in the right places when those parts of the brains were formed.
Right. Now, going back to this woman, Dr. Wallach, where her skin is peeling, I've seen the pictures. Her skin gets really bright red, and then the skin is just, it's like kind of like how a snake sheds its skin. What would you recommend for somebody that is, of course, they want to go gluten-free, but there must be a digestive issue with a bunch of nutrient deficiencies. What would you recommend?
Okay, well, like I said, they got to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, bran, rye, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. They've got to get on the 90 essential nutrients, a healthy brain and heart pack appropriate for body weight. They need to, we're talking about skin now.
Yes, we're talking about the skin peeling off.
Again, the hair, skin, and nails, take 3 of those minimum, 3 times a day, 3 at breakfast, 3 at lunch, 3 dinner time. They're little bottles, so it'd be 2 to 3 bottles a month, depending on their body weight of the hair,
That'd
skin.
be 3.
And then they're also going to need the glucogel. glucogel, because hair is kind of related to skin. It's you know, has to do with skin issues.
Connective tissue,
Yeah.
connective tissues.
Yeah. So we need the glucogel, and I'm the one that created glucogel for Theo Ratliff. I created glucogel because people were, for thousands of years, tens of thousands of years, for 100,000 years, people were boiling bones at night and then drinking the bone broth the next day and getting the collagen, which kept their bones good 300,000 years ago. Now they didn't know all the chemistry and everything, but they knew when they drank that boiled bones the next day, the people who did that didn't get bone problems.
Right. How about collagen, Dr. Wallach? I know you mentioned the glucogel, which is a form of collagen. We've got the collagen peptides that has 5 different types of collagen in it. Would that be beneficial as well?
Absolutely. Absolutely. And it's one of those things where they've, in the collagen peptides, they've kind of pre-digested it for you. So it's easy to absorb. So you won't lose any
It
of it
does.
at the other end.
Yep. It also includes enzymes, which a lot of collagens don't. It includes the enzymes that help break down that collagen so the body can actually utilize it and absorb it.
Is there anything, can I ask one thing? Is there anything she can apply topically? Because it's so bad on her face right now. She feels real depressed.
Well, again, we have a liquid glucogel, which you can drink or put on your skin.
Yeah, don't put on your, I wouldn't put it on your skin, Doc. It's sticky. It's sticky.
Well, then don't ask about what you can put on your skin.
Okay. So I would do colloidal silver just in case that there's any type of infection going on topically. For that, Marilyn, then also take some internally, like Dr. Wallach says, as a dropper on each side of the mouth,
Under the tongue.
under the tongue. Absolutely. Absolutely. So, and in the Longevity skincare line, there is a collagen serum and also hyaluronic acid serum. And folks, you hear acid and you get scared. No, 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 no. This helps with exfoliating the skin and helping to keep this skin healthy. So those would be 2 topical things, Marilyn, that I would recommend for her. Okay, and there's also the Trinity lotion, which has beta glucan in it, which is very beneficial for helping to overcome situations like that and make the skin healthier again. That's the Trinity lotion.
Yeah, and also, I like also for the skin and the brain and the spinal cord and the muscles and so forth, and the liver and the heart, the chewable I-26.
I-26. Well, and that's going to help, most of all, that's going to help with their digestive system, Dr. Wallach. So if there's things going on in the digestive system, the I-26 is so beneficial for that. So I'm glad you remembered that.
And it's also the raw materials to rebuild the brain and the spinal cord. It's not only digestive,
Absolutely.
it's actually what the white matter of the brain and spinal cord is made out of, is in those chewables.
All right. Thank you so much, Dr. Wallach. Now we have Thomas that wrote in, and this is going back to kidney stones. Says diabetics and kidney stones. What about the increased effect or higher probability of kidney stones caused by medication that diabetics use to control their A1C readings, whether it's insulin or an oral, both of which have been studied and found to have higher incidence, like 67% more of kidney stones? Is it just the medication, or is it a combination of the medication and nutritional deficiency?
We have to appreciate that both those diseases, the kidney stones and diabetes, are caused by nutritional deficiencies. Rarely is a person deficient in one nutrient. If you're deficient in a nutrient, you could be deficient out of the 90 essential nutrients, you could be deficient in 50 of them. This
All right.
have places on earth where people only live to be 25, okay, compared to where people are getting all these minerals from the mountains, the glacial milk. They're getting 75 to 100 minerals and they live to be 125 without doctors.
Without doctors, absolutely, without that interference. Well, Doc, we've got several questions with hands coming up and also messages coming at me. So let's go to amount. Is it Mario? So forgive me. Go ahead and unmute yourself. Adame, can you?
Yes, yes. First,
What question do you have for Doc?
well, first, I want to thank Dr. Wallach because he changed our lives. But my question is, I have a male, he's 37 years old and 175 pounds. And he born with small kidneys and he didn't have any problems until he hit adult. He's eating dialysis. And I gave him the health and brain pack, and also the Ultimate Daily Classic, and he's taking that. But would you recommend something else? And I know two more people. They born with the small kidneys.
Okay,
Means they're gonna.
if they're born with small kidneys, yeah, they need the 90 essential nutrients, the healthy brain and heart pack, and of course, it's really a good idea. You did the correct thing. You did the right thing. Okay, by putting them on the Ultimate Daily Classic, that helps get the blood moving through the arteries and veins in the kidneys, even if they're blocked with cholesterol. Okay, and so doctors want to remove your kidneys and put you on dialysis. You have to come in every couple of weeks and go on dialysis, okay, to clean your blood. Get on the Ultimate Daily Classic. Save your kidneys so you don't get them surgically removed by the doctor, okay? And so there's all kinds of stuff. I mean, we deal with over 600 different diseases. We have 2,500 products. We have 2,500 products. We deal with over 600 different diseases. And this is why we have 25 different books. And I urge people, get the basic ones. Get Hell's Kitchen. Go to chapter 14 first. Read Hell's Kitchen, okay? And then get the book Immortality. You want to live to be a long life? Get the book Immortality. Go to chapter 11 first, okay? The Truth About Nutrition. You have to read this book, The Truth About Nutrition, so you understand what nutrition means, okay? And so why do you have to take supplements? My doctor said I could just eat well and get everything I need. You need a new doctor. You cannot, because even the okay, even when you're making your supplements, okay, by boiling bones and so forth, kind of doing a bone broth thing, okay, if you're not able to absorb that, it's going out the other end, okay? So you really need to make sure that you're doing all these things properly so you can absorb the minerals, and you can absorb some minerals just by rubbing them on your skin, okay? But you want to put them on your skin, you want to take them orally. And again, we have the Ultimate EFAs, prevents and reduces the risk of the gallstones.
A lot.
Yeah, the EFA pluses. Okay, and then of course the kidney stones, you want to get them on the OsteoFX and the Caltati. In addition to the Caltati and OsteoFX, get them on those elevated calcium products. But he's got too much calcium. No, he's got the calcium in the wrong place. So you need more calcium, and
Okay, so the small kidneys, they can work normal?
Oh yeah, absolutely.
They work normal,
Yeah.
No matter if they small?
Even if they're half this normal size, they will still work perfectly.
Okay, that's what I want to know, because this man, he said, maybe because I have my kidneys too small, maybe I'm gonna have dialysis for all my life.
He's been talking too much to his doctor.
Okay, Thank you very much, doctor, for
Yeah,
for
now
your
keep us
answer.
informed. Let us know how these things go, because you're going to have great stories.
Okay, thank you. I will.
God bless. Thank you.
All right, thank you. Great question. And Dr. Wallach, Rosie has a question. We've got a female, 200 pounds, 5'3", 55 years old, with a fatty liver. So there is some blood pressure issues, and some sugar issues. But what causes fatty liver, and what can be done to change that? I know the liver itself can regenerate, but we got to give it the right ingredients.
Well, how many ingredients does the liver need?
90.
Well, there you go. If the liver is only getting 3 or 5, you're going to get all kinds of problems with the liver. You get liver cirrhosis, scar tissue in the liver. You get blood clots in the liver. You get the arteries and veins in the liver getting plugged. Okay. And so the liver's kind of like the brain. The brain goes through all those things too when you don't have enough nutrition. Okay. And so you don't want to have a liver transplant. You don't want to have a brain transplant. You don't want to have a kidney transplant. Okay. And so every family should have these books. Every family should have these nutrients. And if you, sign up as a member in the team, guess what? You'll pay the wholesale prices. You won't pay the retail prices. And if you get 2 or 3 or 4 or 5 people in your family sponsored underneath you, guess what? You'll get a check from us every month, and you can use that check to buy more vitamins and minerals to give your mom and dad and your kids and so forth, or sell them, whatever you want to do. It's one of those things where the system is set up to maximize the benefit that we can provide to humanity, no matter where you are at on Earth, no matter where you fall in your family. Okay.
So, Doc, with fatty liver, is it truly fat that's building up on the liver?
Fat is building up in the cells of the liver because they don't have all the right nutrients to have the liver be able to eat the fat and burn the fat.
Okay, so what would you recommend for targeted nutrition for the body as a whole, and then the secret sauce is for fatty liver?
Okay, the Healthy Brain and Heart Pack. The secret sauce for the liver would be the, let's see here, the EFA.
Is it the liver EFA plus? Okay. And the liver formula?
Well, the liver formula is good, but also let's see here, the little pills for the liver. Okay.
That's the liver. Yeah, the pollen burst liver formula.
There you go. Pollen burst liver formula.
All right. And at 200 pounds, that would be at least 2 twice a day on the pollen burst liver formula.
Oh, there you go.
So, all right. Thank you so much, Dr. Wallach. And next, let's go to Hattie. Hattie, go ahead and unmute yourself. We've only got about 10 minutes and 3 hands up, Doc. So, Hattie, can we hear you? I see that she's unmuted, but I'm not hearing her.
Can you hear me, Becca?
Now I can. Go for it, my dear.
Good. Listen, hey, Dr. Well, I just got a call. Young woman, she's 3 months pregnant. This whole time, she's been so compacted. Can't go to the bathroom. She's been to the ER twice, had some enemas. Still nothing. So last night, she said she took a whole bunch, almost a whole box of Docalax, that laxative. And so now, and she managed to go, but now she's worried about how all this laxative, what's the impact on the baby? And what should she do to keep from being impacted like this again?
Well, she needs to take the 90 essential nutrients orally, right?
Yes.
And then, of course, for the happiness of the digestive system, need the ultimate enzymes, okay? Ultimate enzymes. And stay away from all the bad foods. And so this is kind of where you need to start. Don't forget the 90 essential nutrients. And of course, the liver, the intestines, the digestive enzymes.
And I-26.
I-26.
So the laxatives won't have an impact on the baby, right?
Well, the baby requires all these nutrients to develop. If the mother's not getting these nutrients for her, she's going to have a baby born with a birth defect or multiple birth defects.
So Doc, the question is the laxative that was taken, and can that have a negative effect on the baby that's growing within? And Hattie, did you say 2 months or 10 months? I heard 10.
The baby is 4 months.
4 months. Okay.
Well, it's hard to say because, again, when you're taking the enzymes to have a bowel movement, okay, you're getting rid of nutrients as well as getting a bowel movement, okay, and so
Okay.
there can be a loss of nutrients to the level at which there can be a birth defect caused by a lack of nutrition.
So can the chemicals of this over-the-counter laxative, what should she do to make sure it's not
Okay,
the baby?
what she needs to do is talk to her doctor and find out what she needs to do.
Okay.
All right.
Thank you.
Thank you, Hattie.
Thank you.
All right, and let's go right over to Michelle. Michelle, go ahead and unmute yourself.
Great, thank you. So I have a 27-year-old, 6-foot woman, 195 pounds. They diagnosed her with mast cell activation syndrome, which all that means is she has anaphylaxis from food allergies. So cleaning up the bad foods, definitely. And so she's just coming into the program. So what do you recommend?
Well, 195 pounds, she's get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no brown oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. She needs 2 healthy brain and heart packs per month, a full dose serving of breakfast and dinner. She needs the ultimate daily classic tablets. Take 3 at breakfast, 3 at dinner time for blood flow into all the tissues. Let's see here. She needs the I-26 so that her brain and spinal cord are able to maintain themselves. Wouldn't hurt for her to get the Xerafem, the girly tablets that help the ovaries make estrogen and so forth. Okay. And then of course we have the Cal-Toddy, we have the OsteoFX, and we have the EFA pluses. You know, we've got 2,500 products.
Right. Okay. All right, we'll get her started. Thank you so much.
Hey, you're very welcome. Thank you. Yeah, keep us informed.
Albert, go ahead and unmute yourself. What question do you have for
Evening from
Dr.
South Africa, Dr. Wallach.
Yes. Hello, hello.
Yeah. Doctor, what I want to ask is when you're talking about the kidney stones and the gallstones, once they are formed, how effectively would nutrition help to dissolve, and can they be dissolved quite efficiently with the correct nutrition?
Okay, a good diet coming from a bad diet can stop the formation of kidney stones and gallstones. Okay, and here's where they need the 90 essential nutrients. They need the ultimate enzymes. They need the, let's see here, they need the digestive enzymes. And it's one of those things where they need again, the 90 essential nutrients. They need the ultimate daily classic tablets so that the kidneys are working properly. And it doesn't hurt to throw in, you know, we have these other nutrients, okay? Rebound, one of our sports drinks. I love the Rebound because it has so many vitamins and minerals in it that you don't find normally in food, you know, in an average diet. And so the Rebound sports drink, it comes 30 of these sticks in a box. Tear off one corner of this, pour it into a bottle of water and shake it up real good. And I go through 2 of these a day. That's in addition to everything else. I go through 2 of these a day. Okay, the Rebound. And that will give you energy. It will give you raw materials for your brain, your heart, your lungs, your muscles, your digestion, everything to work properly.
Thank you, Doctor. Baie dankie.
Alles van die beste. Tot ziens. Lekker ray.
Baie
All
dankie.
right. And Dr. Wallach, I've got an email that came in. It says, hi, I have a family member diagnosed with prostate cancer that has spread to the bone marrow, causing low red blood cells, low hemoglobin, PSA currently at 89. Doctors want him to take a medication that will affect the pituitary gland and cause chemical castration. Cancer doctor said that his testosterone is what feeds the cancer. So they want to lower testosterone, which is going to cause him to be very tired. They said the medications clean the cancer from the bones. He's also been diagnosed with AFib. They said it's related to the cancer and low red blood count. This individual is 80 years old, 6 foot and 200 pounds, and very active. Well, Dr. Wallach, what would you recommend? I know we can't touch on some of these things, but to help support the body.
Well, that's you said the word support the body here. Get rid of all the bad stuff. Get rid of all the interference. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown oats, no buckwheat, no sugar, no carbonated drinks, no alcohol, no wine, no whiskey, no beer, none of that kind of stuff. Then, and you say weighs how much?
200 pounds?
200 pounds, okay. 2 healthy brain and heart packs for a month, a full dose of breakfast, full dose of dinner time. And then also, I would go again with the support, okay? Because if you give too much support, the support goes to the cancer and supports the cancer, okay? And so basically what I would do is get something like the Cal Toddy.
And I know you have Z Radical on that side of the desk also, Dr. Wallach.
You have
Z
Z Radical, okay.
With the fucoidan, which if you go to pubmed.gov, look up fucoidan and cancer. There's lots of research that is in support of using fucoidan. So that Z Radical could be very beneficial in this situation as well, which at his weight, he could have 4 ounces twice a day. And then how about the BTT tablets, Dr. Wallach? They have a very high auric rate, which is full of antioxidants that support the body.
Which one are you talking about?
The Beyond Tangy Tangerine,
Oh, yeah.
the tablet form.
Mm-hmm. Yeah, BTT.
Yep, BTT tablets. Would you recommend that as well?
Yeah, well, that will help support the immune system. Very good. Good thinking.
All right. Thank you so much for that. Now, Dr. Wallach, we're at the top of the hour. Do you have time for one more question? Or
Okay,
you got a good
one. Let's go for one more.
All right, Ruth Ellen. Thank you for raising your hand. What question do you have for Doc today?
Okay, so on YouTube, we have Olga. She's asking if a 12-week-old kitten can be given bovine colostrum. And then
I didn't hear. She's looking away from the camera when she was talking.
Right, I'm reading. Olga would like to know if a 12-week-old kitten can be given bovine colostrum.
A 12-year-old kitten?
Week.
12-year-old kitten, can it be given bovine colostrum?
Yes.
Okay. And then she wants to know what you think about using cocoa butter for making chocolates and other things like that.
It's fine. Cocoa's fine. I have, in fact, when we're done here, I'm going to go eat a bunch of cheese sticks with some chocolate.
Perfect. Thank you so much, Dr. Wallach.
All right, we are at the top of the hour, so Ruth Ellen, go ahead and stay on, and if our other co-hosts can join us as well. Dr. Wallach, thank you so much for being here with us on Daily with Doc. We appreciate you, your knowledge, and the time that you are continuing, even at 85, continuing
well, thank you for putting all this together. I know we had some difficulties yesterday, But thank you for putting everything together here and so that it works. So thank you, AJ. I appreciate everybody. And so this is a wonderful team. And I am so proud of each and every one of you. God bless you and thank you very much. Have a great weekend.
Thank you, Dr. Wallach. You do the same.
Thanks, Doc.
Absolutely. So, folks, you are an empowered individual. You can make decisions on what you put in your body and have around your self, your environment, to create a healthier lifestyle. And that is what we are all about, in empowering you to make those decisions. You don't have to have a prescription telling you to do it. You can do it on your own. So we do hope that you got some value from today's program on what can be done for some of the most common conditions, symptoms that are experienced, especially in the United States, but I know they're experienced around the world. And it does have to do with our food. It does have to do with nutrient deficiencies. And there are solutions. So get back with your person that recommended you to watch this program. Tell them, okay, what do I need? They're going to help you put together the list based on Dr. Wallach's recommendations and help you get on that road to a better health journey. If there is not somebody that you are working with or that referred you to this program, you may give us a call at 855-949-3377, and one of our certified holistic health coaches will be glad to help you as well. Now, with me on the screen today, and there's a couple other coaches, there's actually a lot of coaches today on the program. I just want to give a shout out to those that are here with me. We've got Ruth Ellen. She's my executive production manager who helps make sure that everything is in place, keeps us organized. Thank you so much, Ruth Ellen. We have Marilyn, which, folks, if you're not in the Zoom, or if you are in the Zoom and you are not looking at that chat, you're not getting the full benefit of the program, where she is putting dictation into and repeating the recommendations that Dr. Wallach is making for the individual, including the symptoms that were given of that individual. Thank you, Marilyn. We have Albert, who is helping to let people in and also field questions, bringing them into the program, joining us from way down south in South Africa, southeast, west, whichever way you want to go. It's still very much south of me. And we have AJ, who is helping make sure that all of the streams are going, checking questions, getting the newsletter out that includes replays and invitations to our program. So make sure that you go to our website, dailywithdoc.com, sign up for that email list and get your name on that so that you also can receive our emails that then give you an easy way to find programs for the past and also those coming up, and follow us on TikTok. So for those of you that are on TikTok and Snapchat and Rumble and YouTube and Facebook, please follow us. No matter where you're at, there is a way that you can follow us. You can send us some likes, some loves, some hearts, subscribe, whatever that platform allows you to do, and share this program with others, because it's because of a program like this that I found Dr. Wallach's solutions that have allowed me to be able to reclaim life, enjoy life, and not dread getting older. That can be for everybody, and maintain good health too. So it's not all about helping the sick, but it's also about keeping the healthy healthy. My name is Becca Dix. Thank you so much for joining us here. If you would like to learn more about Dr. Wallach's philosophy or learn about how to become a certified holistic health coach yourself, go to Coach with Doc. That's Coach, COACHWITHDOC.com, and get more information and sign up, enroll in the Certified Holistic Health Coach course offered by the Institute of Holistic Health. And there is a discount code, a promo code. We love those promo codes. Save 50. Save is all capitals and then 50. So until next time, have a fabulous weekend and we will see you. Be empowered. Bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.